I have one of my gorgeous patients today who is following our treatment plans. We always talk about having a long-term relationship with your physicians because you're going to get the best outcomes if you don't shop around and you trust people. So here we are, second treatment of using Bellafill, and you guys know I talk about this a lot. This is a filler for some reason many doctors are scared of, but we use quite often for long-term improvement in scarring, but it can be used for contouring in the face and other areas of the body, cellulite, indentations after lipo, etc. This is made of a material called polymethyl methacrylate, which basically binds together with the tissue and forms collagen. If you take a look, I'll push just a teeny bit out. I call it the spider web filler because if you look really close, it just hangs off the edge. And the reason that's good is under the tissue, even though people think of acrylic polymers as thick, it's very soft, you see? And those soft particles will become collagen. So we have a very beautiful female here that doesn't have much going on. We shine the light off on the side over here. You can see on the side light here, some of the scars become more apparent. So we're just gonna do baby depot injections right into that spot. You don't do a lot of it. This is 0.05, 0.1 max into each scar. When I did the clinical trials, it showed that if you did this in a micro droplet form and you combined it with other laser resurfacing and microneedling, etc., you not only plumped up the scar, but you also resurfaced the scar and got a better improvement. So we've already gotten a really good improvement, even in one treatment. I mean, really feel like, everybody gets greedy once they get better. They want more, which is fine. You don't want to be ashamed at the dermatologist's office. That's why you're here. So I always say this is like a tune-up. We're coming in, we're just doing a little collagen building or a fine detail to a nice car. We're just going in. And she has little ones kind of all over the place strategically. We're just placing a little bit directly under those scars to plump them up. We're not going to use a ton because you don't need to. We're going to turn now to the other side. Same thing right over here. There's a little cluster. Perfect. There's a little cluster right there. And if anyone's commenting, let us know. But we're going right under those and fine-tuning. And things like Fractora, which is microneedling radiofrequency, or Fraxel laser, peel. This will also help long-term to kind of remodel these scars, but when these are indented like this, you really need to plump them. That's the best option. I'm going to save a little bit for the forehead. She has a couple baby spots up in the temple, just a little. You don't want to overdo it. You don't want to lump or a bump. And again, if you do micro droplet injections, call it micro depot injections, you're never going to have a problem. Doing right superficially right under those scars. Just a little bit more on this side.
Is the plumping permanent?
Yeah, long term, once this builds, there's just a couple spots here you can see. One kind of right here. Mm-hmm. Long term, this will build and form a permanent improvement. Let me see on the other side. Just watch the bleeding there if you have a cause. So
Joy
again.
says hi and he says you're fabulous.
Thank you. Me or her?
Both.
Probably both of us. I hope it's both. That's nice of him. Thank you guys for following. So you see we can even treat small areas in the forehead. You just got to go nice and slow with the injection, but turn over here and we'll finish up. There's even a little scar. Little scar is kind of back here. Fine. Great. So that...
said your lips are beautiful.
She is gorgeous. Yeah. Don't look at my lips. They're dry and dehydrated. Dry and dehydrated without fillers. I need all of that. So that's basically Bellafill plumping of superficial textural irregularities. You guys, it's not just for deep scars. If you have irregular texture, cobblestoning nature, sort of not an even tone or texture of the skin, you can combine lasers and fillers and get a really good improvement. All right, stay tuned for more. All right.